degree medical students from the University of Sydney in Australia. While we're lucky enough to live in a country that has handled the pandemic appropriately, we still feel the effects of disinformation. It is not new for people to spread rumors, conspiracy theories, and find scapegoats during times of uncertainty and fear. Technology in the 21st century has allowed easy access to information on a global scale, but this also means that false information can be spread easily and fast.
In this digital age, one of the key innovations that we have transformed the ways we communicate and interact with one another is social media. Nowadays, news can be produced and viewed in seconds. Australia currently has a population of 25.36 million, and it is estimated that 20.5 million are social media users. That is an 80% penetration. In 2020, TikTok was the second most downloaded mobile app in Australia after Zoom. Unsurprisingly enough, since COVID and lockdown, screen time has risen, with most users spending 7 hours per day on connected devices, and an estimated 1/3 of that time is on social media accounts. This rise in usage is not just seen in the younger generation, but is across the board in all age demographics. Even more compelling is the fact that coronavirus is still one of the top most searched terms on Google. What does this tell us? This tells us that the way we consume mass media has gone from paper to television to now social media. It tells us that people do want to use this new technology to connect with one another, but also as an information portal. This provides us with an easy way to disseminate information. By utilizing these free platforms, we will be able to share information to people that are already out there looking for it. We believe that some key ways to do so is to create accounts for coronavirus task force on the major platforms: Facebook, Instagram, TikTok, Snapchat, Twitter, and YouTube. Through these websites, we can create little clips giving facts on the coronavirus. Some special features such as a live video function on Instagram and TikTok can allow the public to ask questions, and we can invite key speakers to answer them. Some key speakers that would be ideal for this situation would be frontline health workers or scientists. Another key feature that can be included in the polling is the polling on Instagram stories, so we can see what the public believes and truly understand the amount of disinformation out there. Only when we know what is out there can we provide a course to correct it. This also brings us to the darker corners of social media, in which anonymous users now have personal access to target journalists and key figures in this pandemic. One way to combat this is to continue to support social media in their verifications of celebrities through the blue checkmark. We should make an effort to ensure that our coronavirus task force accounts are all verified, thus giving us a very visual stamp of approval and legitimacy. Another way to combat this is to encourage social media companies to continue their disinformation campaign, in which there's a little pop-up warning whenever users bring up information on COVID. To strengthen this, we should create targeted pop-ups that pertain directly to the information that is spread by users. For example, if a user spreads a conspiracy theory that 5G is currently giving us coronavirus, there can be a pop-up for anyone that views this post which directly discusses what 5G is and why it does not relate to coronavirus. Doing so would inform users already targets of these posts, as well as combat the disinformation without impinging on people's freedom of speech.
Contact tracing proven to be a key component in the containment of COVID-19. The pandemic has opened doors to massive success for touchless technologies, with QR codes at the lead. Australia has 90% mobile phone penetration nationwide, and paired with the compulsory use of QR code check-in implemented by some states, it has become a potential powerful medium in promoting information on COVID-19 while simultaneously combating misinformation. In December of 2020, New South Wales alone had over 50,000 businesses implementing the Service New South Wales QR codes, with 2 million people having used it already, once again highlighting the accessibility and efficacy of the app. With the high prevalence of smartphone and QR code usage across Australia, including rural and remote regions, we propose the utilisation of these codes as an effective technological measure to maintain objectivity and provide clarity on the virus. With every check-in, a daily statistic in regards to the spread of COVID-19 can appear as a pop-up message, and the variations in these messages are endless. There could be messages of fact-checking, medical information including signs and symptoms to look out for, information on vaccines, and what to do if exposed to infected people. These are all already available through the government website, but streamlining it together with apps will not only increase convenience and access, but exposure to the wealth of knowledge that is currently poorly promoted to those without information of its existence. With QR code check-ins now a part of our new norm, it is an obvious step to utilize these apps to promote true and correct information. There has been an outpour of misinformation and false statistics in regards to the pandemic, with sensationalistic articles flaming dangerous perspectives, as well as politicization of the virus. It is crucial to put an end to this, as there is no place for politics, disinformation, or racism in this threat to human life.
As previously discussed, nowadays it has become commonplace to look around and see most, if not all, individuals on their smartphones. And with COVID-19, smartphones have become even more instrumental in Australia's swift ability to contact trace via QR scanning and pop-up notifications. The utilization of smartphones may be may have become very customary to the rest of us, but for 28% of Australians, that is 7 million people, smartphones may not be the most accessible tool to use for contact tracing or spread correct information about COVID. That is because these 7 million people live in rural and remote Australia, where it is still popular to watch cable TV and listen to COVID-19 updates through this medium. To be able to reach this particular demographic, we need to be able to adapt and utilize the technologies they currently have access to. One way to do this is by introducing a free cable access channel on TV where we can incorporate what was previously said by my colleagues onto a TV medium. We can partner with local news networks and the cable network to set up this TV channel and have different experts have time slots to discuss and present accurate evidence-based information. Examples of experts we can request appearances from are health professionals like specialist physicians, nurses, or researchers, or university professors in the fields of public health, infectious disease, virology, and health and medicine in general. These experts would present accurate information and their knowledge about the transmission of COVID-19, the mechanisms of the vaccine, and have a 24/7 telephone line to answer phone calls and questions. This can be a way to combat the spread of misinformation in regard to the themes of origin and spread of COVID and medical science. Individuals can tune into this channel for reliable, correct information in regard to the infection if they have limited access to the internet. We could also have experts in economics and statistics to address this misinformation in regard to the economic impacts and statistics of COVID-19. Overall, having experts in a variety of areas will serve to address the spread of false information, and we can show their credentials, references, and the proof backing their claims. In addition, we would hope that these experts can make appearances on a voluntary basis as to preserve most of the budget for our other mediums and for staging and setup costs. We would hope that this could be one of many effective mediums to apply towards this particular demographic of Australians.
In a country like Australia, where it is commonplace for people to listen to the radio while commuting to work or eating breakfast, it's an important media target for spreading current and accurate information to keep audiences well informed. Some may even rely on radio to stay up to date with the latest developments in their community or area. This could be changing restrictions or social distancing policies, exposure sites in isolation, vaccine rollout, or latest information. Radio is a powerful tool to deliver a trusted and reliable source of information, and it is crucial for governments to utilize it during this pandemic to keep communicating with and keeping its audiences informed. In Australia, the government currently uses advertisements in radio to spread its messages. What could be done in addition to this is to have dedicated Q&A airtime for coronavirus-related questions, or even a podcast for coronavirus information relevant to Australia. This will allow for more interaction with listeners and a continuation of conversation. The key is to creating a culture of trusted and accurate information source that is reliable and familiar to the consumer.
The reach and accessibility of modern-day social media is instrumental in our information sharing reform plan, but by employing several different modalities of technology beyond social media, including radio, television, hotlines, and QR codes, we are creating an online environment of trustworthy and up-to-date information. We also need to ensure that this information has meaningful effects not only online, but also offline, by measuring the efficacy of these programs and adjusting them as needed. This may include assessing not only the viewership of our broadcasts, but also engagement with our content. Social media in particular lends itself well to tracking clicks, views, shares, saves, and reposts of each piece of content. By measuring what kinds of posts are creating the largest waves in different groups of people, we can tailor posts to have a greater impact on certain groups that require more targeting. We can also measure to what extent people trust our messaging by directly polling our audiences. If people deem our messages inaccurate, untrustworthy, or irrelevant, we can ask them what sources they find more reliable and try to pull aspects from those sources and apply them to the way we deliver our messages. It is crucial to incorporate input from the community you are targeting. Ideally, these programs and monitoring systems will translate to increases in vaccine uptake, social distancing, and other COVID-19 prevention measures. The ultimate goal is to have a decrease in community transmission, a statistic that is already closely monitored by public health units across the country. The initial budget will largely be used to hire professional fact checkers and editors. Costs can be kept to a minimum by using a clear and consistent message across different mediums, including recycling soundbites from one platform to another. If Australia does see a positive correlation between COVID-19 prevention outcomes and the uptake of our information reform, then that would support the use of our programs and allow continued funding from the government into expansion and continuation of such programs.
In summary, we have tackled the COVID 2019 infodemic from all angles across different demographics, and with the intent to proactively measure efficacy and adapt to the ever-changing pandemic situation in Australia. Thank you for your time.